The third topic of the talk is, indeed specifically perhaps in the case of failure with an anti-TNF, what treatment are we going to administer as second lines? Well, I brought a poster that was presented at the Euler series, and well, I also brought the author, who is my third-year resident. So, this poster indeed indicates to us that is primary failure to an anti-TNF a predictor of non-failure to a second anti-TNF in the treatment of spondyloarthritis? What we did was a descriptive, observational, and retrospective study where we included 289 patients with spondyloarthritis who were undergoing treatment with biological DMARDs and JAK inhibitors. As first-line treatment, 85% were on anti-TNF, 10% on interleukin-17 inhibitors, 4.8% on IL-12 and IL-23 inhibitors, and 0.2% on JAK inhibitors. We observed that 27% of the patients experienced primary failure to anti-TNF, and 15.4% had failure to an interleukin-17 inhibitor. We only selected patients with anti-TNF failure and gave them 90% of them another anti-TNF. And it was observed that 42% experienced a secondary failure. However, those differences were not statistically significant. Therefore, the conclusion of this poster was that failure to one anti-TNF does not predict failure to a second anti-TNF. All of this is in line with the recommendations. I think we need more studies to determine which treatment we should use next. But based on what we have, in the case of failure to one anti-TNF, we can use another anti-TNF. Another option is IL-17 or another JAK inhibitor. It needs to be individualized. We have to consider whether there are extraskeletal manifestations or other comorbidities. It's somewhat up to the rheumatologist's decision. And well, also, I believe that in clinical practice, after many years of experience, that's what really helps you.